So my name's Kevin Campbell. I am a cardiologist in North Carolina, at the University of North Carolina, Chapel Hill. And I work with Fox News and NBC 17 and some other media outlets. I've been trying to pioneer the use of social media in medicine, and it has been a challenge because all of you are so engaged and so involved in social media. You understand it. My colleagues do not. And I want to talk to you today and show you a little bit of what I am doing to engage my colleagues so that they engage patients and make a difference, because we can make a difference through engagement in social media. So why is this talk important? Well, social media is the way doctors are going to communicate with patients in the future. Social media is the way docs should promote themselves, their skill set, what they can offer patients in the future. Social media is the way to engage patients. And we know that if I engage a patient in their own health care, their outcomes are going to improve. If it's a passive one-way relationship, it doesn't work, because I can tell you how to make a difference or what to do. But as Jeff told his story today, you have to decide yourself and then work with someone to make it happen. So why should we discuss this at a wellness conference? Social media is here to stay. I'm not telling you guys anything. You are very, very engaged and very connected. It is the future of medicine, and I'm trying to tell my younger colleagues as well as my more gray-haired colleagues the same thing. I get laughed off the stage a lot. Social media is gaining momentum, and by getting involved now, both as physician and as patients and as other healthcare providers and as wellness experts, we can set the tone and set the stage for how this is going to work going forward. We also know that medical students and emerging physicians, and I'll show you a little bit of data that shows that, are actually engaging. So I think there's hope, because the folks that are now training and coming out of residency in medical schools understand social media and are using it every single day. I am in the elevators sometimes or in the stairways running between hospital rooms, and I'll be tweeting or engaging in some way or another. I use every spare minute to do this. As you guys know, there's a massive amount of information that has to be processed by patients and others, and it's just, how do you process all that information? I feel like as a physician who's engaged in Twitter and other social media sites, I can help filter out the junk and bring it down to what's important from a standpoint of a disease-specific state. So you guys know this, but I have to tell my colleagues this. Social media is really internet-based applications which allow the creation and exchange of user-generated content, can be social networks, professional online communities, wikis, blogs, and microblogging like Twitter. I would argue that my most important thing that I do is Twitter and blogging. What is social media not? And I have to tell my colleagues this. It's not a fad. It's not a replacement for other types of advertising. It's certainly not a first step or a magic bullet. And it sure is not free. As you all know, there's a lot of sweat equity involved in social media. It's not all about me. It's all about you. And that's why it's so important at this conference. Social media is a huge deal in medicine. It's going where my patients are and where I need to be. It's time-consuming, and it's all about you. That's what social media is. As you guys know, the Big Five, and I know I may be boring for a couple of minutes, but this is what I'm showing my colleagues across the world, and that's why I think I want you to see it. The Big Five are Facebook, YouTube, LinkedIn, Twitter. There's others out there, but these are some that if I can get my colleagues to just engage in these things. So really, as you guys know, social media is where I'm going to talk to one person about, hey, you need to stop smoking so you don't have a heart attack. Instead of just talking to that one person, I can tweet, hey, do you realize that smoking in the U.S. as of today has shown a decrease for the first time in 4 years? There was now 19% of Americans smoke. It had been level at about 21 to 23%. And I can broadcast this, but I got to engage the guy with the microphone. In other words, I've got to be engaging. I've got to make it where people want to follow me on Twitter, want to read my blog, so that the message can get out there. Because if I get connected with one really well-connected person on Twitter and they think I have something to offer and they have 100,000 followers, then that message can go to 100,000 people and impact lives and impact people's ability to stay healthy. As you know, blogging, there's about 200 million blogs, and most of them fail in the first year. Over 90%. Why do they fail? Because you don't stick with it. You don't have engaging content. You don't have something new, and you let it die. you gotta blog constantly. Be moved about something that's going on, and then throw your feelings down on a piece of paper, or, in our world, a laptop. Give visitors a reason to come back. You're an expert in your field when you blog. You influence opinions, and you can really engage patients or other physicians and say, hey, maybe I'll blog about the way a particular patient felt when they were labeled as being anxious and crazy, when actually they were presenting with a heart attack and they were just having atypical symptoms like many women present. Blog about that. So maybe I've now engaged some female patients who are potentially that patient who was mistreated, and also maybe I've educated some of my colleagues. That's what I'm talking about. Things that I blog on, I use WordPress because it's easy. The guidelines say 2 times a month. I blog a minimum of once a week as best I can. You don't want to write an essay that's, fit for a term paper. I usually use 500 to 750 words. They're not press releases. I use WordPress. So Facebook, gosh, everybody uses Facebook. 400 million users. Almost everybody uses Facebook almost as much as you use Amazon, Google, and things like that. An important thing to remember is the average age is 38. So this is folks that are in the prime working and spending and engagement periods in their lives. So this is all of us in my cohort right now. I'm 43 years old. And, it's our job to make sure that this continues to flourish. The younger folks that are coming up, the millennials, as I like to say, are already there, and we've got to learn something as the older crowd from them. I Facebook every day. You want to feed your blogs, you want to feed your content, you want to connect everything together. So if people only find your Facebook, then they maybe see your Twitter. Friend pages are for individuals, fan pages are for businesses. Twitter, as you know, average age is 39, 100 million users. It is a wonderful, wonderful way to connect. Only 20% are active. You want to be very engaged, very connected. Respond to news, create a buzz, engage and motivate patients. Twitter can move markets. Imagine what it can do for an individual group of patients with a disease process. As you guys remember, someone said that there was an attack on the White House on the AP Twitter feed because someone had hacked it. The Dow dropped, and then they figured out it was a hoax, and it went right back up. Imagine what you can do to a patient group. So what is an important way of integration is your own website, and I think a lot of you guys that I've met today have that, and I think it's so important because it can pull everybody to your content. So what's the bottom line? How should we use this in practice? Well, it's interesting. This was from the American College of Surgeons, so this is the data I wanted to show you. 64% of doctors have a Facebook account. 80% don't use Twitter. 80% use YouTube, and I think that's because everybody likes to YouTube the guy skateboarding off a cliff or something because it's funny. And, so I don't think that's professional use. And then if you ever participate in a blog, about half. Now, this is the point that I wanted to make that I think is so critical. So have you ever used any networking sites? These are American College of Physicians again. 42% of physicians, meaning practicing old guys like me, 79 or 80% of residents, and then almost all medical students. So we're on the right track, and I think healthcare is going to move that way to where we engage in social media. 89%, however, of these folks polled were personal. What I want to do is get people to stop being afraid of the legal implications, understand the legal implications, making sure you don't develop a doctor-patient relationship via Twitter, but give advice. And I'm going to tell you how we do this. Meaningful ways to use social media. Bucket 1, to treat. I'm not saying treat this man. I'm saying, hey, if he's talking about a particular symptom, I think you might want to go and engage with a healthcare provider because I think you're at risk for this, that, or the other. We can teach. We can have an online Twitter chat about inflammatory bowel disease or heart attacks or smoking cessation. We can consult. Great story. I was in the middle of the night up looking at an EKG at 3 in the morning with a crazy tachycardia. I thought I knew what it was. It was pretty rare, and I knew that. I've got a buddy of mine who's my age, and I tweeted a picture, direct message, because it wouldn't violate HIPAA. He was a physician, and I said, this is what I'm thinking this is. And he says, you're right. That's what I think it is. I treated the patient based on that quick consult at 3 a.m. I don't know why he was up at 3 a.m. Bucket 4 is to market. You certainly want to grow your business as a physician or grow your brand, and that helps you, as well as your reputation as a key opinion leader. That's what this does for you. For physicians, you can develop market, you can advertise, you can present yourself and your practice as an expert, national recognition, media interview and press opportunities, patient education and patient engagement. That is the most important. My own return on investment for all the sweat equity is that, I've been picked up by the Wall Street Journal, New York Times. I love moving people through my words. Interaction with other social media leaders, and I think this is one of the biggest things. I've met so many virtual friends, some of which are here today, and they've made me a better physician because a patient in social media says, this made me feel really crummy when I was treated that way. And I thought for a minute, I get that. Let me make sure I never do that, but let me also make sure that I help my colleagues understand. You can't do that. This is a human being that needs to be treated a different way. A lot of times I'll get calls for same-day comments, and I have to think, Jeff, I was supposed to go on at noon today, and I was on a flight over the Atlantic with internet service, which is way cool, by the way, and I got a call from Fox News that I have to do something at noon today live, and Jeff was kind enough to move me early, and I appreciate it. It's about the third time he's moved me. Twitter chats for support groups and patient support groups. Like, I implant defibrillators, and, having a piece of metal in your chest is a very anxiety-provoking thing, and so I think it's important that we relate to one another when we have the same disease. Opportunities to engage and learn from others. I do a lot of radio and TV. I do Fox News. I have my own show on NBC back home. I get to move people instead of seeing 35 people in the office in an afternoon and impacting them. If I say the right thing at the right time and the right people are watching, 30 million people may be convinced not to smoke, like I'm going to talk about today. There's a lot of cardiologists that are active in Twitter. A lot of you may know Eric Topol, very famous cardiologist, but I'm very excited to be part of this list now because I think Twitter is very, very powerful, as you guys know. So, with 2 minutes and 58 seconds to go, I'm still on time, and I want to wrap this up. Social media is important. It's here to stay, as you guys know. It's not going anywhere. I've got to get my blockhead doctor friends to understand this is how we need to do medicine in the future. It's integrated. You got to have your Facebook, your Twitter, your YouTube, everything linked together, and I like to link it at the hub, which is the my own website. It's a tool that I can use to achieve greater market share, have more patients come see me, and impact more lives, engage more patients. It can connect MD and patient in a way like never before. It can improve care. When I engage a patient, care improves. The time to get involved is now for all of us, for patients, for physicians, for other healthcare providers. Why? Because if we don't set the standards, somebody else is going to write a guideline for how we can do this. And a lot of times that's the attorneys. We need to certainly abide by privacy laws, HIPAA regulations. Certainly don't want to engage in doctor-patient relationships on Twitter or social media, but we can define how this can be done in a way that respects patients' rights and privacies, but also makes a difference in patients' lives. A friend of mine said once that Facebook is like a singles bar and Twitter is like a ticker tape parade. With that, finished with 1:36. Thank you so much for having me.